cases and as well as deaths in the U.S.?
Well, I think some of the citizens not adhering to the the health regulations put in place, like the social distancing, the uh, wearing of masks, washing of hands, particularly the issue of wearing of masks. There have been some resistance in some quarters, in some states. At least now, in the U.S. is becoming uh, a general law, that everyone should wear masks, and that's what is being stressed uh, in every part of the country. Uh, the lack of testing, particularly a limited amount of accurate testing kits, which the U.S. is still confronted with, since it did not wake up earlier on in the beginning, just as other countries around the world, in order to confront the virus and mount a response. And so these are among some of the major problems, the major issues, irrespective of the fact that there is a very good healthcare system. But if the healthcare system does not have the necessary equipment to work with, particularly protective gear for frontline healthcare workers, uh, you will have a situation that we have on hand presently.
That's correct. And let's come back home, Dr. Yan. This is my second conversation with you. Initially, we were talking about your perspective or some of the steps you thought we should take in fighting the virus and some of the issues. At the moment, we have a little over 1,200 confirmed cases. I was just checking the numbers this morning. We have 81 deaths, and we're doing. I don't know. From my point, I thought we're doing well in terms of recovery. But you are following the situation back home. Are we making progress? Are we making gains? Do we still need to improve? What do you think?
I think there's a lot that needs to be done. Before going further, again, I would like to express my sympathy to the family of the late Representative Muna Pella Youngblood, who passed recently, and her funeral was just carried out lately, and to that of Representative Nangbe Slaw as well, who is a relative of mine. We express our sympathy to the entire nation and the family in particular. All of this has come about due to the lack of the basic health care facilities that we need in the country. Take, for instance, in fact, the flying out of our vice president just a day or two ago to Ghana for medical treatment. It signals the fact that there is a need for government to pay keen attention to the health sector, allocate much budgetary allotment to healthcare, to scientific research, so that we will get back to that state at which we were in the 1970s, and even far beyond that, when Liberia, the JFK hospital, was the premier referral hospital in pretty much in sub-Saharan Africa, where we train doctors all around Africa. These are the glory days, and more than that, that we think we want to return to. Under those conditions that our healthcare system has been dissipated, by the lack of adequate funding and the recent COVID-19 outbreak, toppled on with the past Ebola outbreak. This is a very serious condition that our government needs to pay attention to. I know that a little has been done, but still much needs to be done. Healthcare workers that are on the front line are still crying out for salary payments. Those that were selected to carry out contact tracing, as opposed to the 3,000 already trained contact tracers that we had, are now, just as we said, are now demonstrating or carrying out protest actions for their pay. There is a lack of ventilators, enough that we will need to contain the virus. There is a lack of the requisite medications that we need. I doubt if our country have imported remdesivir, which has been proven to have some effect against the virus, which we could use. And these are some of the issues. Now, looking at the question of the manner in which testing has been done in the country, one could then think that our advice previously is still not being heeded to. The advice of getting enough testing kits, not just enough testing kits, but accurate testing kits. The question of performing accurate testing, the question of establishing not just one testing center, but 2 or 3 sub-testing centers in the country, just as has been done in Rwanda, where they have about 7 or more testing centers now. So these are some of the issues that are confronting our own response. And the entire process of the incident management system not being headed or infused with the requisite know-how, those who are actual epidemiologists, who are scientists, infectious disease scientists, that can mount a response that we had during the Ebola outbreak. That is not happening in this situation. So these are some of the hurdles that we are faced with that are confronting the current response.
Somebody will argue that in spite, yeah, because I know you talk about Liberia's testing regime for the COVID-19, you say it's completely inaccurate, and you're talking about the revamping of the incident management system. We'll come to that. I will ask you in terms of specificity, what do you want to see? But what do you say to people who think that, we're doing very well, compared to other nations? I was looking at the numbers from Sierra Leone, Ghana, Guinea, Nigeria, other countries, and some of them are way ahead, 7,000 and all those kinds of things. We're still right here around 1,000. We have a very good number. And remember, the 1,250 we're talking about is inclusive of the numbers of active confirmed cases, the recoveries, and the numbers of deaths. People think, in spite of the poor healthcare delivery system we have, which is true, Liberia is doing significantly well.
Liberia could have done far more better if the proper mechanisms in confronting the COVID-19 pandemic were put in place. If Liberia has started much earlier, like other countries, we also started late in our response. There were a lot of complacency. But if you look at what is going on in Sierra Leone and the rest of the countries around us in the region, they are doing far more testing than we are doing. And so you can see with the silent asymptomatic spread of this virus, they are catching they are catching a lot of cases within the communities. Liberia is not doing as much testing as the other countries are doing. And so you can look at it from that point. Yes, definitely we have 81 deaths presently, and we have 1,250 confirmed cases. But you will note that that is an increase from what we had previously. As we indicated, the more testing we did, the more our cases will increase because we have an increase unknown amount of infected persons within our population. So the lack of robust testing is what is giving us this false impression that we are doing well.
So what do we need to do mass testing, Dr. Yan?
We need to do mass testing in order to actually know a good number of our population that is infected. That way we'll be able to.
I'm asking what do we need to do that? What do we need to do mass testing? Manpower or what?
What do we need? Okay, I thought you said why do we need it? Okay, now I got your question. It was not too clear. We need manpower. We need trained manpower to carry out effective testing. We need enough testing equipment. We need enough and accurate testing chemicals and reagents. Those are the two things that we need. We need additional testing centers to be set up. Once we have those three things, we are able to mount accurate mass testing. In addition to that, we also need an effective contact tracing, because we must be able to trace those who are infected by way of identifying those those who are, the infection has been transmitted to, by identifying those who were previously infected. So if we don't have a mass testing system, we will not be able to identify those who are infected and then trace their contact. So those two things are interdependent. Once we are able to augment those efforts in terms of manpower and in terms of chemical reagents and accurate testing or reagents testing kits, I think we will do a lot better than what is being done now.
When I extended you the invitation, to be my guest today, I started to do some little bit of research, and I was eager to learn from other countries. There was a specific medical doctor in Zimbabwe, for example. He wrote a paper, and he was concerned about what he called the unscientific testing of contaminated dead bodies in some African countries. And he said the unscientific contaminated testing of dead bodies in some of the countries was affecting productivity and the way they should respond to the situation. Do you hold that view?
Well, if you can recall, this was a big argument earlier on in March and April, when I was one of the first scientists that raised that question on your show, and I think on Julius J's show as well, when Liberia had a case fatality rate of about 10 to 11%, far above the regional countries in our region and far above the global case fatality rate. And I did raise the question of unnecessary and unscientific testing of dead bodies. I did lay out the conditions under which dead bodies could be tested. That is, if that living body was in a care or under the care of the observation unit or at the hospital and earlier diagnosed or suspected of COVID-19, then within a certain space of time, post-mortem, meaning if that person passes, within about 30 minutes or so, that space of time, samples could be taken for testing. But beyond that, just picking out dead bodies from on the street that have been lying for days and days, or bodies that have been embalmed or preserved by formaldehyde, like the case in Tapeta sometimes ago, that will not give you an accurate testing result for COVID-19. And so I think that particular scientist, if a doctor, if your research is right, have come to confirm exactly what I was saying, that in the space of, in the wake of the lack of enough testing reagents, such testing reagents could be used to diagnose, people who were suspected of COVID-19 instead of wasting the reagents on their bodies. The unscientificity of the matter was such that the virus is an RNA virus. Let's go into a little bit of the science. And RNA, as opposed to DNA, is very fragile. It degrades very quickly. So you have a body lying down that is dead for 3, 4, 5 days that have been lying down. All the cells are dead, and the virus needs those cells to survive. The virus would have died by then. and then the RNA, which is that genetic material that we need to detect in order to say the person is positive, or not detect to say they are negative, has degraded already. So where was Liberia getting these positive results from? Those were my question, and that is why initially at the time I did question the results, and I did call for the establishment of an independent scientific panel to investigate those results and the testing procedures used to obtain them. And I have said if they came back to be faulty, those results should be thrown out. And that places a lot of our results into question.
Now, so what will you suggest, or how do you see, what new method do you think we need to use in our testing of bodies, for example?
Dead bodies can be tested. Again, let me state here, but under certain conditions. If that living body was under the care of, the thing is that Liberia has to define her own protocols in line with the general global protocols. But you have to look at specifics, given your own local conditions. Liberia has to have her own model. Up to this point, we don't know what epidemiological model Liberia is using to mount her response. So it's just like, picking from here and acting here on knee-jerk situation. Now, what Liberia actually needs to do at the moment is, again, those recommendations that I put forward some time ago. Revamp the entire incident management system. Put in place people with the expertise, personnel with the expertise, with epidemiological expertise, with infectious disease expertise, with scientific expertise. It should be a purely technical committee or technical system. The next thing is infuse a lot of resources in testing. That way, acquire enough and accurate testing kits. Look at countries in Europe, for example. What testing kits did they use? Let us take Germany. You look at the example of the Germans. See what testing kits they use. Look at the example of the New Zealanders. What testing kits did they use? Because there are a lot of testing kits on the market. When I say on the market, not necessarily being sold, but being spread around even through philanthropic means. And those have not been validated by regulatory agencies. So we have to know what sort of testing kits they are using. That I personally don't know up to now. There were testing kits donated by Jack Ma some time ago. They must have been depleted by now. But those testing kits they were in Addis Ababa for a long time, sent to the local sub-distribution center in Nigeria, and they were sitting there for another longer time. So with that length of time that these reagents, these chemicals are sitting around, it exposes them to being vulnerable to affecting their quality. So the question is, how have testing been conducted in Liberia? Who's conducting the testing? Are there competent personnel? And I know when I was there last year, I carried out some workshop, and we have some very smart laboratory technicians, in fact, and personnel. Dr. John Dougbeh, who is the head of the National Public Health Reference Lab, for example, he is an excellent laboratory professional, and he has a good team. But there needs to be an addition on some of those smart and expert one that he has. They need to be given the proper protective gear. They need to be adequately armed with the tools to carry out their work. Proper sample collection, proper handling, proper processing of the samples. And the equipment being used have to be well calibrated, meaning that those equipment that are used to do the testing, they have to be well taken care of, and make sure that our biomedical engineers that we have, like Goosen and William Wisse, those are expertise that can be employed with others in order to maintain a good testing regime. So if these basic things are put in place, and of course, the healthcare workers are also taken care of in terms of their remuneration, we will have an effective response being mounted. You require also an invitation to some of the expertise that we don't have in the country, that are outside of the country, that are willing to come in to help out. You can, look, this is a village. You know how Africans are. We are a communal people. If something hits one person, it hits the entire village. And so these kind of responses need to be mounted from that village communal mentality, instead of isolating people or disenfranchising people with expertise who could come in and provide the necessary skills that are needed. So I think the government needs to rethink its strategy.
And one other thing the doctor said, because I read a lot of things he talked about and a lot of recommendations he made. One other thing he talked about, Dr. Nyan, is the issue of the mix of patients, names, and data. Do you think it's also, affecting our response effort?
What was the question again?
The mix of patients, names, and the data.
Certainly. I have spoken about that. In fact, just recently when I spoke with over 30 or so journalists from the country and within the region, as well as some international journalists, I did speak on that, and I have spoken about that some times ago. You need a quality processing of documentation, quality data collection and data processing. You cannot mix up patients' information. We saw this happening as a classic example with Madame May Jean Best's situation, the wife of the Esquire publisher of the Daily Observer, Mr. Kenneth Y. Best. The crew went to pick her up with the ambulance and asked if she was this 39 or 37-year-old lady that they came to pick up, when she was not. So how do you mix up that kind of situation? How do you mix up patients' data? So they need to be very careful. And in the testing centers where data are collected and samples are labeled, samples need to be properly labeled. And this is the seminar that we had on sample handling some times ago, that is Celebrate Lab, which is conducted by Africa Bio Incorporated, held some times ago for West African Laboratory. We held several seminars. This was one of the major points that we stressed: sample handling. Samples and specimens of patients or will be tested, or samples taken from patients need to be properly labeled. They need to be properly placed so that there is not a swish in names or even in the valves that you use to collect the specimen. That alone creates an accuracy question. And at the end of the day, it creates an issue whereby your results are not trusted, because you will be giving one patient's result to the other. So if this was surgery, for example, would you have been cutting somebody's leg if that person's chart was not included in that person's chart that the leg should be amputated for complications of diabetes? That means you would take the diabetic patient's chart and mix it up with someone who was not even going on a surgery. So these things are very, very important. We are talking about human lives here. Telling somebody they are positive for a particular disease is a very big psychological burden that is going to be placed on that person. It requires immense counseling. It requires immense caution as to how you give results. And so mixing up of results is something that is of concern within the Liberian testing regime. which is one of the problems that we have been seeing. So the doctor is also correct. And again, all of what I have been saying all along is been confirmed by other professionals. So it's all has been meant to help our system. You know, we are scientists. We have to be critical. We have to think critically. And that is how our students were taught before, to think critically, not just to memorize or not just going on Facebook and throwing out insults on people by using the keyboard. Think critically. If the argument defeats you, you succumb and agree. You don't resort to insults. Think critically. So all of this requires critical thinking.
Now, you have been very persistent in your call, and you just said it again, for an independent scientific panel to review testing procedures and results. So what do you think could be the composition of that kind of independent body?
The body could comprise of, and you see, when you carry out an investigation, you're trying to eliminate most, if not all, of the biases, potential biases that would have been into play. And so you try to get people who will be as neutral as possible, but with the requisite expertise in order to investigate a particular situation. This is a situation of diagnostics in pandemic response. You need people with epidemiological expertise. You need personalities with diagnostic expertise. You need medical doctors, you need nurses, and then you need someone from the community. All of these people are part of an entity sometimes that we call the IRB, the Institutional Review Board. It has all of these qualities of people. I think such a composition or such a board would be more appropriate to be used than, for example, having a commission set up to investigate diagnostic irregularities and using the Minister of Justice. The Minister of Justice can be dealing with the recent violence that went on. That's a lot that they have to deal with already. Why bring them into the investigation of diagnostic irregularities? You need somebody who has done ethics, for example, to be on such a committee, because all of that has to do with the personnel's ethical responsibilities. So those are the quality of people that you need. You need people who, you don't need anybody from an international body to come and become part of this committee, because the international bodies themselves that are health related are part and parcel of the process of guiding this whole testing thing. So one could refer to them some questions as to what sort of guidance did they give to the Liberian pandemic response. So they themselves need to answer or provide some sort of information. And so that's the kind of composition that I would think about and I would suggest, for which I refer to as an independent scientific body.
And I know you were talking about the recent committee set up by His Excellency the President, to do some investigation, including the Liberian Medical and Dental Council as the chair, the Minister of Justice, Madam Amawen Dix, Deputy Minister of Foreign Affairs is on our committee, the country representative of U.S. Center for Disease Control, and all these people. But when you read the executive mansion release, it says Dr. Musoka Fala has been suspended for time indefinite for ethical, professional, and administrative lapses. Dr. Nyan, how do you respond to this?
Well, it is unfortunate that the director met this kind of fate. Quite to his credit, the president must be commended for paying attention to it, this time around, because these are questions that I raised over and over from the beginning. And I hope we had addressed them at the time I raised this very question of the diagnostic lapses that were going on. that our country was experiencing. The question of indeterminate results, the question of false results being given, wrong results being given to the wrong people. All of these things we raised. This is not to say it is I'm accusing Dr. Farah of doing this, but one, the president's action has come a little late, or the government's action has come a little late. The constitution of the committee itself is welcome. I had just laid out the composition, what the composition of that committee should have actually been. I excluded the justice minister. I excluded certain personnel. I'm glad that we have the Liberian Medical and Dental Association on that committee, whereby I also named that there should be medical doctors on that committee. So again, the National Public Health Institute is our leading and only infectious disease control institute in the country. The director in the initial stages was removed as head of the incident management system. For what reason, up to this point, we did not know. And we did request those reasons. Why was he removed from the incident management system? The incident management system was composed, I believe, about 2 or 3 times, or reformulated about 2 or 3 times. And he was excluded from that. So why? How will you be mounting a pandemic response and you exclude the head of the agency that should be mounting this response? So who was mounting the response? Where were the decisions coming from? So all of these problems came about with the misstep in the reformulation of the incident management system. Now, with what went on at the NPHIL, we would think that the government should do its best in reconstituting. I will propose again, reconstituting the committee that has been set up to carry out this investigation. It should be reconstituted to exclude those who do not have the expertise to investigate this. Include those with the expertise. We need the doctors there. We already have the Liberian Medical and Dental Association. We also need diagnostic scientists on that, people who are accurate with the process of diagnostics. The justice minister is not going to delve into diagnostics. I mean, and this is the actual issue that we are talking about. We're talking about ethical breaches. So you need someone who has expertise in dealing with ethics of science. And we have I believe we have the IRB, which is the Institutional Review Board, or some sort of entity like that in the country. A personnel could be taken out of that particular board and put on this committee. So the committee needs to be formed so that the results that will be produced will be the result of an in-depth and professional investigation, so that it is not a mere political investigation and then we don't have the actual results that we need and we will not be able to address the problems that we need to address, which is the diagnostic problem and the ethical breaches, alleged ethical breaches that we talk about.
Doug, before we open the telephone line for public interaction, do you see the possibility of us getting a vaccine for this pandemic anytime soon? I'm asking because I was reading last evening and I heard about something coming up from Russia.
One, I don't know of the Russian vaccine studies. All of the countries that have been carrying out vaccine studies have been reporting their results sequentially. There have been a lot of studies done in the United States here. There have been a lot of studies on vaccine done in the UK and in China and other parts of the world, in Europe as well. I haven't seen any reports or any vaccine study data from Russia, so it is quite striking. If the Russians have produced a vaccine, we would like to see the data, we would like to see the studies that were done. It has to go through 4 major clinical trials, which is the phase 1, phase 2, phase 3, and the phase 4. The phase 4 when it is already in the market and they are following it. But that phase 1 trial will have to do with telling us how safe this vaccine is. The phase 2 trial that they might have done will have to tell us how effective it is. The phase 3 trial will tell us about the safety, the effectiveness, and side effects, if there are any. And then just as many other vaccines candidates that are currently in process of the trial. Merck is carrying on trials. Johnson & Johnson is carrying on trial. Novavax is carrying on trial. The University of Oxford is carrying on trials. As a matter of fact, one of the trials of the University of Oxford vaccine candidate is being conducted in South Africa. So these are candidates vaccines that we know about presently, and we hope that in the next 6 to 12 months, again, it's not going to be a quick fix. Within 6 to 12 months, we should be having an approved candidate by the US FDA and other regulatory agencies, but it's not coming anytime at the end of this year.
Dr. Dougbeh Chris Nyan is a Liberian scientist. Now, just hold it on there, or I don't know, via the internet, do you have the capacity to listen to us and then we'll rejoin you later, or what? We hold it on?
Where do I go in order to listen to you?
Just go to Facebook, OKFM Liberia. If it's going to take some time, then you just hold the line and then we talk to you from right here, and then I will repeat some of the questions, but then we will not take people on this, if it is possible.
Okay, let me see if I can get the OKFM.
Okay, all right. Just go to Facebook and say OKFM Liberia. You'll see it, and you scroll down, then you'll see me. When you see me, then that's the place. Then let's take some calls now. Dr. Nyan will get back to us. 0777-700-995. For now, 0777-464-050-0555-995-995. Hello, caller. Good morning. call on this line. Hello. Good morning, Clara. Good morning. I was listening with Dr. Young, Bob Young, the Morovia. Bob, go ahead. I think basically he's trying to use that all the point you made out of it because Clara, as a matter of fact, I don't intend to estimate our guns on the ground, but part of the reason why our cases are lower is because we are not doing massive testing. Because if you do a massive testing right now, people who are asymptomatic, you will realize that the number will grow. When you talk about it, I think one thing we need to take serious as the country is opening on one of the ways that if the ministerial agencies are opening up, staff that are coming back to work, you do look at the testing and give you the result before starting job. I think those will also help in the processes. Okay. Okay. Yeah. Thank you, Bob. Thank you. Let's see. Okay. Hello. Good morning. Okay. Hello. Good morning, sir. Okay. So I'm very happy to get you this morning. I call from Central Morovia. So you have this critically and carefully to well-learned scientist, Dr. Nyan. And I try to follow him very closely. But anyway, some issues that I think I want to get some clarity from him as it relates to his expertise. What they want to suggest to us as it relates to the gold standard for diagnosing somebody for COVID-19. Because the reason why I'm asking this question is talk about rapid testing. From my own information, I think that we have been doing some rapid testing as screening method, maybe followed by NPHIL to come up with some, accurate diagnosis. But from his presentation, I will really appreciate when he to follow elaborate on what he could recommend as a gold standard for diagnosing COVID-19. Thank you. Recommendation for gold standard of COVID-19. Hello. Good morning. Okay, thank you. It's important that you said. Hello. Good morning, Good morning. I have one question for the doctor. I don't want to get shot. That is right. Is he saying that once I got dead, can I be tested? No, I think he said you can be tested around 30 minutes after your death, but now 1, 2, 3 days. Sometimes it undermines the process. I think that's what I heard you say. Okay, so that's why I'm all right, thank you. let's go back to Dr. Nyan because we got less than 6 minutes. Dada, are you there?
Yes, I am. Thank you very much for the questions, some of which I heard and some of which, if I don't refer to, you can restate. One of the questions was if I could come to Liberia to help out with the response. Yes, I have since February this year, January and February this year, at the beginning of the outbreak, when we alerted the government and provided a roadmap, just a skeletal roadmap as to how to begin preparation before the virus hit us. I have proposed to the government that I was ready to bring in my team of infectious disease experts and diagnostic experts in order to develop Liberia's own testing kits, in order to help train and beef up our own testing capacity in terms of training more diagnostic personnel and setting up diagnostic centers besides the National Public Health Laboratory, setting up additional diagnostic centers. I made all of this proposition and indicated that I was prepared to come in with my team. The Liberian government had not contacted me to come. So I just wanted to make that clear because this question has come over and over, and the question has to go back to the government. Why up to this time? And you will note that we are suffering from lack of testing kits, lack of good testing reagents, and all of those things. Another question that I heard was regard to rapid diagnostic tests. Yes, there are a lot of rapid diagnostic tests being used currently. And also the qualitative polymerase chain reaction, which of course is the reverse transcription qualitative polymerase chain reaction. Those are the two forms of tests that are being used. Just recently, through the Celebrate Lab West Africa, which is organized by Africa Bio Incorporated, we did and are still providing a series of webinars on this question of the COVID-19 response. Our last seminar or webinar was on the diagnostic challenges, and we dealt in depth with the two different types of diagnostics. Rapid diagnostic tests are being used. They are actually serological based, and I will go into the terminologies because of the individual colleague who asked this question. And the PCRs, or quantitative reverse transcription PCR, are molecular tests. Now, you get a positive, you can detect using PCR within a particular space of time. Just for the space of the limited time we have, I will not go into the detail. For the rapid diagnostic tests, which are serologically based, you can also detect within a particular space of time when the antibodies are built. You may be detecting IgM first and then detecting IgG later. So that lasts for about 3 weeks or so and then begins to decline. When it declines and the peak goes down, you may miss that detection. Within the first 2 weeks after infection or symptoms show, you are able to detect with polymerase chain reaction as well. And after those 2 weeks, within the third, fourth, fifth week, you may miss it because then the viral load would have also gone down. Please check your references, and if there's anything, contact Clarence, and we can send you those slides that we showed during that particular webinar. So those are the two tests that are being used. It is left with the particular diagnostic jurisdiction to evaluate the two tests and use them concurrently in making diagnostic decisions. And this is the tact, this is the technique, this is the experience that is required. That is probably much of which is lacking in our own diagnostic setting in Liberia. So when we talk about improving the diagnostic setting, all of this come into the picture. There was a question about mass testing. Yes, we do mass testing in order to know we may not know the exact number of people, but there are a lot of asymptomatic carriers. There are a lot of asymptomatic infected persons in the community that are transferring the virus, transmitting the virus to others. that has become scientifically proven that asymptomatic carriers do transmit the virus. And so we need to know, and we can only know those asymptomatic carriers through mass testing. So uh, testing of a lot of people in the community. That is what we call this mass testing. And that is the only way we will know. That is the way we will trace their contacts, and then we'll go after those contacts. Contacts, if there's a second or third generation contacts, we will trace them. And if they turn out to fit the criteria for being isolated, they will then be isolated, taken care of, treated if treatment is needed, or observed if just observation is needed, and then put back in the community or allowed to go back in the community. So that's what mass testing is for. There's a question on testing of dead bodies, which I think Clarence made very clear. I have indicated that dead bodies can be tested. You know, people can be tested post-mortem, but it should be within a required space of time. Because if you're testing a body that has been contaminated already through injection or infusion of formaldehyde for preservation, you would have already contaminated that body. A body that had been lying down for 3, 4, 5 days, those cells would have already died. The virus would have died, and the RNA would have degraded. So it would be very, very difficult to say that someone would test such a body and get a positive result. And this has been an issue in many jurisdictions, not just Liberia, but because we're quite familiar with this, we've tried to transmit this expertise to our people and hope they take these things in good faith. Someone talked, I don't know if I heard about the question of healthcare facilities. That is why we are calling for enough budgetary allocation for healthcare. Look at a situation whereby we have very good doctors in the country. And somebody mentioned that we have good doctors, which is very correct. We have good doctors in the country. But if the doctor does not have the tools to work with, you may see them not to be a good doctor. So look at Dr. Arvin Nando, for example, one of the young upcoming neurosurgeons in the region. Okay, we have a neurosurgeon, and he was able to diagnose the case of Dr. Sawyer. Dr. Sawyer, one of my mentors and teacher, you know. So Dr. Nando, thank you very much. Congratulations, my dear colleague, for such an excellent job. Now, he also performed a neurosurgery in Liberia under those conditions some times ago. Imagine if you built for him a good surgical theater with the kind of equipment, diagnostic equipment that he needs. You know what it means to open somebody's head and look in that brain and take out a disease, and that person is healed? That's a big job. Let me just put it as simple as it is in our Liberian English. That's a really big job. We have another doctor who's going to specialize in orthopedic surgery, dealing with, the bones and other things. Okay, Lawoba or Bozi. And we have several others. I'm just using these two as an example. So if our government can provide the necessary equipment for them, they will also be able to teach others, because each one teaches another one. And that's how we transfer the knowledge.
Okay, Dr. Yan, thank you ever so much for being with us this morning. Let's hope we can have more of these kinds of conversations as our country fight, to get its epidemic out of here. Thank you so much for making yourself available this morning, Dr. Yan.
Thank you. You are very welcome, and look forward to speaking with you again. Good morning, Liberia. Good morning, everybody. God bless you.
Thank you. Dr. Dougbeh Chris Nyan is a Liberian scientist. He's based in the United States of America. We'll be talking about